This is the Less Insurance Dependence podcast show with my good friend Gary Takas and myself, Naren Raja.
We appreciate your listenership, your time, and most of all, we appreciate your intention to reduce insurance dependence in your practice. Our goal is to provide information that will help you successfully reduce insurance dependence and convert your practice into a thriving and profitable dental practice that provides you with personal, professional, and financial satisfaction.
Hello, everyone. Welcome to the Less Insurance Dependence podcast, the official podcast of the Reducing Insurance Dependence Academy, www.rid.academy. Membership to the Academy is a gift from Gary and I in appreciation for your listenership. Visit rid.academy and do not forget to register. By registering, you will have access to all of our resources and a free pass to all of our events, including our annual summit. I am Naren, your co-host. Today's podcast is titled, What Percentage of Patients Who Have Dental Insurance Use Their Annual Maximum Benefit? Those of you who know me know that I run a marketing company, and I know one of the things that keeps practices at night, I've worked with dental practice owners for like 18 years now, is understanding all these nuances of working with PPO plans. I mean, there's hundreds of rules, and this will work with this plan and that won't work with that plan. And then pretty much, as all of you know, their number one goal in life, at least if you think about it, the insurance company is to not pay you claims. So they'll come up with all these rules about, annual maximum and this and that and everything else. So today's topic, I think, is going to be a wonderful topic where we're going to take an in-depth look based on some recent data that we were able to get to. So Gary, take it away.
Yeah, this is an interesting question. Let me tell you where the answer comes from. I discovered an association recently when I was doing some research that I had absolutely no idea even existed. Naren, have you ever heard of the National Association of Dental Insurance Plans?
No.
No, neither did I. However, there is such a thing. And as I did my research, I understand that as far as insurance executives go, this is their association. Kind of like the ADA, the American Dental Association, is the association, for practicing dentists. Well, apparently this is the association for the executives in insurance companies. And so they published some research recently about utilization of the annual maximum. Now, let's talk about the annual maximum for just a minute. So typically, what we see today in terms of annual maximum, in other words, insurance plans, unlike healthcare plans, will have an annual maximum. In other words, they'll provide only up to this amount per year. And sadly, that annual maximum hasn't changed all that much since insurance first came into being. Dental insurance came into being in the 1960s. Now, let's look at, say, 1968. That's about when we started to see insurance more utilized. What do you think the annual benefit was? In other words, covered by a plan, how much you get each year if you used it all. What do you think it was in 1968?
I think it was around $1,000.
$1,000, yeah, you got it. It was $1,000.
Mm-hmm.
Well, let's look at what $1,000 bought. Crown in 1969, again, according to my research, was $150 on average, and it was covered at 50%, just like it is today. So that meant for a Crown, the patient pays $75, and the insurance company pays $75. And that $75 the insurance company pays goes against the annual benefit, the maximum benefit. So how many Crowns could a patient get in 1968? I'll do the math for you, Naren. It's between 13 and 14. 13 and 14. If your Crown at the Crown fee of $150, you could get between 13 and 14 Crowns. That's not a full mouth reconstruction, but if you did some of the Crowns in November and December, and then you did the remaining in January and February, you could essentially get a full mouth reconstruction done in 2 years worth of insurance benefits. Wow. Today, Naren, fast forward to 2025, which is the time we're recording this, There are many dental insurance plans that still have $1,000 annual max. It's the same $1,000. Now,
Right.
sometimes it's better than that. We see plans today at $1,200. I've seen some at $1,250, $1,250. I've seen some at $1,500. Now we're starting to get into the outlier category. Not many in that category, and then occasionally we'll see some more than $1,500. But the majority of them still fall in the $1,000 to $1,200 range every year. Naren, is that your experience?
That is my experience, Kerry. Yes. I mean, the unfortunate thing is, if I were to just sum it up in one sentence, the cost of living has literally gone up 6 times, 7 times in those 40, 50 years. But the payout, the maximum payout you get from the insurance company as a patient is still pretty much the same,
So what is that $1,000 or $1,200 annual? How many crown? Remember we talked about in 1968, they got 13 to 14 crowns.
Yeah.
How many do they get now?
Not even one.
Well, one if it doesn't need a root canal.
Yes.
It needs a root canal. Now we're over the limit.
Yeah. So, I mean, this is why you have tooth dentistry, right? Like they can only do one tooth at a time and, just barely keep people, like with cleanings, that's it. Like anything more than cleanings, it's like a luxury nowadays.
Well, and I actually think that a lot of patients that have this dental insurance think, my employer gave me nothing. This is nothing. This is garbage regarding their insurance. If it only covers one tooth, it's garbage. That's the way a lot of consumers think about it. But meanwhile, who's making all the money? Well, the dental insurance companies are.
Exactly.
Because here's the data. I'm going to answer the question. What percentage of patients who have dental insurance use their annual maximum benefit? Naren, I think you'll be blown away, as well as I think our listeners will be blown away if I was to tell you the answer, according to the National Association of Dental Insurance Plans, is 2.8%.
I know.
2.8% of people that have insurance, dental insurance, use their annual maximum. Isn't that crazy? I would have thought that number would have been much higher.
Yeah. I bet that's a number that they optimize for. They want that number to be as low as possible as insurance companies.
And that's why they're not going to raise their annual limit. Why would they need, when they say, wait a minute, let's round 2.8 to 3%. 97% of people don't use it. Why do we need to raise it?
Yeah, exactly. That's the argument, but they make it so hard, which is why people don't use it. Like there's 300 qualifications and 400.
And exclusions.
Yeah,
and
exactly.
gamesmanship. Like, the one that really bothers me is the 6-month wait between the hygiene appointments. So if your patient comes in, your good patient who's being faithful, and they come in 5 months and 29 days after their last hygiene appointment, that claim will be denied. Will be bounced and denied because it didn't meet the 6-month wait. So the sad reality is that 97% of people that have dental insurance don't use the maximum benefit that they have. Now, if they don't have needs, let's say they're in good shape and they come in twice a year and their teeth clean, that's fine. That's great. But in reality, I think a lot of time they have needs and they're either not going to the dentist or, the fact that there's such a significant co-payment, they really feel like the dental insurance isn't helping them at all. Which really leads me to the point of this podcast interview. I think when people come to the dentist because they have insurance, when they're brought to an office because they have insurance, what they really want is free dentistry.
Yes.
They want that free cleaning, and that's one of the reasons. Now, some of you might have to take a leap in faith to believe what I'm about to say, but I think if you think about it, you'll believe it. Why are cancellations so high for hygiene appointments? They're higher with people. I have the data on this. The cancellation rate is higher. The cancellation or no-show rate is higher with patients that have insurance than those that don't have insurance. Why does that? What does that say to you? What does that data point say to you, Naren? You're a data guy. What does that say to you?
It tells me that those with dental insurance don't value it because
it's free.
Yeah.
It's free.
We don't value things that are given to us for free. Even a child. I mean, like 2 kids, 1 kid, you pay for everything, right? Like their school, their tuition, their room and board. The other one has to work hard and pay the tuition. And usually the one who works hard values everything, right? Like,
Your value. Yeah. And so the reality is that they have this thing called dental insurance.
Yeah.
They're tricked into thinking it's a good thing. 2.8% of them actually use it, to those mousy maximums. Those are lousy maximums.
Yeah.
Naren, if you had, think about this for a minute. You like math. I think you'll like this. The $1 million practice is still, for some, is still considered to be, the aspirational goal, to create $1 million practice. If you had 1,000 patients in your practice and all of them used the annual benefit, let's say they had $1,000 annual award and they used their annual benefit, that's all you'd need to have a $1 million practice.
Right.
1,000 times 1,000 is $1 million.
Right.
Right. But it doesn't play out that way because only 2.8% of them are going to actually use their annual maximum. And that's because they don't really value it. They don't really value it.
Right.
So I think this calls into question of, how does participating with PPO plans really build your practice? And I would politely say that it works against you to build your practice because you're attracting people that really don't value what it is that you're providing.
Mm-hmm.
And they're not likely to accept elective treatment. Because how do we know that? Because when you present elective treatment, what's the question that comes out of the patient's mouth?
Is it covered by insurance?
It's covered by my insurance. When your answer is, no, they don't cover this. Oh, I'm out. I'm out. And is that any way to build a practice? I mean, do you want that type of, we use the term patient, but would you like that type of customer in your business that doesn't really value what it is that you provide? Not really. So some things to think about. But let's come back to that 2.8%. I think one of the things we can do is we can do a better job of raising that number internally in your practice. Do you think we could do that, Naren? Think there's things we could do to get people to use their annual award?
Right. We can.
And we can. Don't just ignore it. Like, for example, we can send that end of the year insurance letter. Use it or lose it. Right. Universally, when people get that use it or lose it, it says, although treatment is never determined by insurance. However, if you do have a need and you have benefits, you may want to get in before the end of the year, because when the clock strikes midnight on December 31st, when the ball drops down from Times Square, if you haven't used those benefits, they do not carry over. They go back to the fat cats at the insurance company. Right. Here's something else you could do. Think about your practice and think about the age distribution of your practice. Many practices today have a very diverse age distribution. For example, I'm thinking of a client that just this morning I had he's a client in our Thriving Dentist coaching. And I asked him, I said, hey, what's the youngest patient in your practice? And he said, 2 years old. He said, we do see kids. We're not a pediatric practice, but we do see kids. And we recommend a first visit at 2 years old. I said, what's the oldest patient in your practice? He said, oh, I know that one because I just saw him last week. He's 97. 97. So look at the age distribution, 2 to 97. Now, that may not be typical for everyone, but that's not uncommon to see that diversity of ages. So if you have silver-haired or no-haired patients that are, older, maybe they're in their late 50s, early 60s, a lot of times these patients will talk to you about, oh, I'm counting down the days, only 3 more years till I'm retired. Can you imagine that conversation coming up, Naren, in a relationship-driven practice? Can you imagine?
Absolutely. Yeah. 100%.
Hey, doc, I'm counting down only 3 more years. I think we can identify our senior patients. We know if they're working because we have their records. And we can say to those patients, George, I'm kind of celebrating with you. I'm counting down with you to your retirement. And I hope these last work years go really well for you. But one of the things we should talk about is we should take a look at what's going on in your mouth while you have dental insurance. We should take a look at it and maybe proactively plan some treatment to get you as healthy as possible before you retire. Because most people, once they retire, they don't have dental insurance benefits. Now, Naren, can you imagine that conversation landing well with patients?
Yes, absolutely.
Absolutely.
Yeah.
And again, we're not saying we're doing treatment because it's covered by insurance. We're saying while you have these benefits, let's do some planning. We might take some records and proactively solve some things for them while
Yeah, I
they
think
have
the way to think about it, if you're a practice owner, is to say, here are some free stuff you have, like coupons you have. Let's make sure we use those coupons when you do your renovation project. But of course, you're going to still do your renovation project to make you happy, not to make the coupons happy. You know what I mean? Like you're going to do what's necessary for your home, and coupons just help. They are like tools. They just make it a little bit easier on you. That's all they are. Nothing more, nothing less.
The obvious one is the patient that comes in every 3 years, whether they need it or not, for their cleaning.
Right.
A
Right.
note tongue in cheek about whether needed or not.
Right.
We can say, George, do you know you get 2 of those visits covered a year?
Yeah.
Do you know that? And most of the time they do. Yeah, I guess I do know that, but I haven't really been paying attention to it. Well, let's get you on a regular schedule. You've got the benefits. Let's get you on the regular schedule.
Right.
And obviously that leads to more exams, leads to more treatment, leads to lots of maybe it leads to a patient that becomes more interested in their oral health. Well, as we wrap this up today, what percentage of patients who have dental insurance use their annual maximum benefit? The answer is 2.8%. 2.8. And I think we need to be on a mission to help your patients raise that number. The insurance company executives of the National Association of Dental Insurance won't like that when that number goes up, but it's going to help your patients, and that makes it worthwhile. Well, as we wrap up today's episode, I want to take a minute and thank all of our listeners. We appreciate each and every one of you here at the Less Insurance Dependence Podcast. You might want to share this. It might be wise to share this episode with some of your colleagues, because I think the data point is really stunning. It was really surprising to me. Feel welcome to share this. We love new listeners. Feel welcome to share this with your colleagues. On that note, thank you for the privilege of your time. And Naren and I look forward to connecting with you on the next Less Insurance Dependence Podcast.